My name is Justin Bannister, and I'm a nurse practitioner student at Auburn University, and I'm going to talk for a few minutes about supraventricular tachycardia, or SVT. SVT is a type of tachycardia not involving the sinus node and is maintained by the atria, or the AV node. It can be split into three major categories known as atrial tachycardia, AV node reentrant, or AV reentrant. The latter two are the most common forms of SVT that are diagnosed. SVT is typically paroxysmal with narrow complexes and rates between 150 to 200 beats per minute, but even sometimes higher. SVT commonly affects ages 12 to 30 years old, and women are more affected than men. Some risk factors include extreme stress, tiredness, anxiety, depression, hyperthyroidism, pregnancy, tobacco and alcohol use, stimulant use such as caffeine or decongestants, and substance abuse such as cocaine or methamphetamines. Three key questions that you'll want to ask patients when evaluating them for SVT are: when did the symptoms start, and what were they doing when they started? This is important because the longer somebody's in SVT, the higher their odds are that they can decompensate and become hemodynamically unstable. You'll want to know if they're experiencing any chest pain or shortness of breath, difficulty breathing, because this can point to cardiac ischemia or other major concerns. You'll want to know if they're experiencing palpitations. Palpitations are the most common chief complaint with somebody that's in SVT and kind of can point the provider in that direction. As far as physical examination components, the first and foremost is your general survey. You'll want to know immediately, does this person look stable or unstable? Are they awake, alert, and oriented, or are they not talking to you? You'll want to conduct a thorough cardiovascular assessment to include listening to their heart sounds, listening for carotid bruits, checking their pulses, and obtaining a blood pressure. This will help determine what their rate and rhythm are, and it will also determine if they're hemodynamically stable. You're also going to want to conduct a respiratory assessment, checking for any adventitious breath sounds. You're going to want to obtain an EKG, a 12-lead EKG, to confirm the diagnosis of SVT, and then you can think about treatment options. So as far as treatment goes, for somebody that's stable, you can start with vagotonic maneuvers or Valsalva maneuvers, such as having them put their head between their legs and coughing or bearing down like they're having a bowel movement. If they don't have carotid bruits or any other contraindications, you can attempt a carotid massage for 10 seconds, or you can also try a cold water face immersion. Sometimes that does the trick. The next step would be intravenous adenosine, which is administered in 3 doses separated by a minute or two. You start off with 6 milligrams followed by a 20 cc normal saline flush rapid IV push. Then you jump up to 12 milligrams and then a second 12 milligram dose for a total of 3 doses, so 6, 12, and 12. You can also try intravenous calcium channel blockers such as diltiazem or intravenous beta blockers such as metoprolol. In an unstable patient, immediate cardioversion is the treatment of choice. So this is somebody that needs to be in an emergency department, so you need to get them out of your office very quickly if they present to you that way. Somebody with recurrent SVT may need to have a cardiology and an electrophysiotherapy consult, and maybe a candidate for radiofrequency ablation. All these treatment options, the goal is the resolution of symptoms and conversion into a normal sinus rhythm. Once this patient is stable and converted into a normal sinus rhythm, it's important to teach them about trigger avoidance. So, avoiding caffeine, alcohol, tobacco, not using cocaine or methamphetamines, making sure they're getting plenty of rest, stress reduction measures, diet and exercise, all those types of things. You're also going to want to teach them how to Valsalva them, at home. So teaching them how to bear down, cold water immersion, things that they can do on their own before, having to come into the office or present to the emergency department. And lastly, you're going to want to teach them when to seek emergency treatment for their SVT if it reoccurs.